health war. Who is the enemy? This enemy is the novel coronavirus, also known as Covid-19, which is engulfing the whole world at a rate never seen before in history. Countrymen and women, Zambia first recorded cases of Covid-19 on 18th March 2020, involving a Zambian couple who had returned from holiday in France. Shortly thereafter, cases were detected among a group who had returned from a religious meeting in Pakistan. Over the last 5 weeks, cases have been increasing steadily, and local transmission of the disease has set in. Quick and decisive measures instituted by my government have ensured that potential rapid spread of the outbreak is averted and mitigated. Following the expiry of the 14-day extension period of restriction and other control measures I announced in my last address to the nation, I now update the nation on the current position. As of today, 24th April 2020, 8 additional cases of COVID-19 have been recorded in Zambia. 4 of the cases are from the community, while the other 4 are hospital personnel. The cumulative number of cases in Zambia is now 84, including 3 deaths. 37 patients have recovered from the infection, and 44 patients remain under isolation, but all are in stable condition, except for 1 patient being treated for severe malaria. 15 healthcare workers have so far been infected with COVID-19 while in their line of duty. 2 have recovered, while 13 are stable and remain in high spirits. Countrymen and women, like I said in my second address to the nation on Thursday, 9th April 2020, the frontline workers are the real heroes of our times, and they need massive support from us. They are leaving their families for days to contain the enemy on our behalf. They are doing this at great risk to their own lives and those of their families. They are protecting our lives day and night, and they are saving lives of the sick. I pay tribute to them and wish those who are sick quick recovery so that they can continue to do what they do best, saving our lives. Countrymen and women, this is why my directive in my last address to the multi-sectoral response led by the Minister of Health to ensure these men and women are protected at all times cannot be overemphasized. For the work they do, let us pay back to them by ensuring they are protected at all times. I therefore direct that the multi-sectoral team should ensure that all resources that have been sourced so far, especially the personal protective equipment, PPEs, are quickly availed to these frontline workers. Countrymen and women, I must acknowledge that the country has received huge donations from local and international donors following the outbreak of COVID-19. Therefore, I would like to thank all cooperating partners and assure them of prudent use of these donations in accordance with the Public Finance Management Act of 2018. Countrymen and women, As you may be aware, today is exactly 1 month since I announced the initial measures, and it is now time to take stock and review what has taken place in our country in the fight against COVID-19. As we strive to preserve the country's health security by scaling up COVID-19 control interventions, we remain alive to the impact these interventions have on the economy of the country. Countrymen and women, we have to choose life or livelihood or both. Our expenditure on COVID-19 has been unplanned. Our exports are constricted. Copper prices are all-time low. Tourism has been run aground due to COVID-19. The exchange rate is not as it should be, and business out there are hurting. I feel your pain. I do not need to mention you individually, but I know that little outlet there that has been closed brings in shimmer to your table. That little outlet that has been closed pays your rent. That little outlet pays school fees. But it could have been worse had we locked ourselves completely in to avoid COVID-19 from coming to Zambia. There are other questions that require answers, which have an impact on the socio-economic affairs of our country, bearing in mind that currently our national budget has been thrown into disarray as a result of the COVID-19. If we maintain the status quo of the controlled movement of our people and the restriction of some businesses due to the pandemic, where will the money come from for the many other important programs in the country? Where will we find money to pay salaries for our public service employees? Where will we find money to pay retirees? What about FISIP? What about the money for social